Well, the NHS NICE guidelines have a number of recommended treatments, including mentalization-based therapy. And mentalization-based therapy, MBT, helps a client mentalize, which is, it's not a very helpful word, but it's normally thought of as help them to think about thinking. Because what happens when you're suffering from a borderline personality disorder is that you're very caught up in your feelings, and your ability to cope with your feelings is very low, it's very impaired, trying to regulate how you respond to your own feelings. So we typically see a lack of impulse control. A client feels bad and they do something about that by hurting themselves or hurting people around them, or doing something that doesn't help the situation but actually makes it worse. So mentalization-based therapy is working with the client to try and stop that process, trying to interrupt and to get in the way before the feeling turns into an action, and to turn it into a thought. So you will work with your client in a very grounding way, trying to really look very closely and analyse moment by moment what's happening to their feelings. And it's a hard therapy, because it means you have to bring those anxious feelings into the room. You can't sit there nicely chatting about something that happened last week. You have to almost reactivate it. So you can't work in an MBT way without having some anxiety in the room, but helping and enabling the client to process that anxiety differently, so that they can start to experience themselves as a thinking person who is in charge of themselves, rather than somebody who is overwhelmed by themselves. The other part of mentalization-based therapy is to help clients understand that other people have their own beliefs and feelings and needs, which might be different to the client's interpretation of those thoughts. So typically somebody suffering from borderline personality disorder will feel persecuted or got at or attacked, when actually in reality they aren't being. So mentalization-based therapy is about helping the client to face adversity and to be able to reflect on it, rather than to feel persecuted by it. And it has been described as learning the ability to see yourself from the outside as others see you, and to see others from the inside.